All right, this is our documentation in nursing by Kylie, Madison, and Sienna, and Carla. These are our table of contents, so feel free to read them. Our introduction. Today, we will be discussing the importance of documentation in nursing. Accurate documentation ensures clear communication, patient safety, and legal protection, while also supporting research and compliance. Let's start by defining nursing documentation. Definition and purpose. Documentation in nursing. Systematic recording to patient care, treatments, and progress. Serves as legal and professional record, ensures accountability and continuity of care. Now that we know what documentation is, let's explore the purpose in nursing. The purpose of documentation facilitates communication among healthcare providers, supports patient safety and continuity of care, provides legal protection, and aids research, billing, and compliance. Beyond its purpose, documentation plays a key role in patient care and healthcare operations. Let's look at the importance of it. Importance of documentation ensures continuity of care and enhances patient safety, reduces errors, and improves communication. Protects patient and nurses legally and supports research, quality improvement, and regulatory compliance.
So next we're going to talk about the topics of documentation. So there's six types of documentation. First is electronic health records. So digital documentation allows for real-time access, improving efficiency and reducing errors related to misreading handwriting. Next one is narrative charting. This method provides a detailed chronological account of patient care and observation. It's useful for complex cases and can be really time consuming. Next is SOAP notes. So subjective, objective assessment and plan. Subjective is what the patient reports. Objective is a measurable observation. Assessment is the diagnosis, and plan is the treatment. Next is DART notes. So it's data, action, and response. So data is the objective and subjective finding. Actions what the nurse does in response, and response is how the patient reacted. So the next one is flow sheets. So it's used for tracking routine data such as vital signs, medicated administration, or intake and output. Charting or exception instead of recording every normal finding, only abnormal or significant changes are documented. This saves time for required nurses to be thorough in noting changes.
Okay, so the third is legal and ethical considerations. Next slide. Okay, so I will be discussing these certain terms here. So these are very critical in ensuring safe and responsible patient care. So negligence, it occurs when a caregiver fails to provide the expected standard of care, resulting in harm to the patient. So for example, if a nurse forgets to turn a bedridden patient, that can lead to bed sore, so that could consider, negligence. So for malpractice, that is a more specific term of negligence. So that applies to licensed professionals. So let's say RNs, APRNs, any healthcare provider that fails to meet professional standards, such as administering the wrong medication. Scope and standards of practice, that defines what nursing is, who it involves, and why is it essential. So who? So that could be RNs, CNAs, APRNs. Those are the ones who are responsible for practicing nursing. So those are, they're educated, they're licensed, and required to maintain active credentials to make sure they have high standards of care. So nursing is involved more than just providing medical care. So that's about protecting, promoting, and optimizing health and advocating for like individuals, families, and communities. Wherever the patient is, that could be in a hospital, that could be in a nursing home, that could be in schools, or even in home health settings. And also when. So whenever the nursing knowledge, compassion, and expertise are needed, It can be in emergency, routine care, or long-term treatment. And why? That's the nursing profession that exists to achieve the most positive patient outcomes. So lastly, non-maleficence. I'm sorry, I can't really pronounce that word, but it's an ethical consideration. That's an ethical principle of saying the saying, do not harm. So that means to always provide safe, effective, and high quality care. Okay. Impact on patient care and safety. Effective documentation plays a really important role in both patient care and safety. Accurate and thorough documentation ensures a continuity of care, allowing healthcare providers to make informed decisions while supporting clear communication between nurses, physicians, and other professionals. So that helps, track patient progress too, assess treatment effectiveness, and make necessary adjustments, to care plans. And also additionally, efficient documentation reduces delays into, sorry, in treatment and prevents redundant tests or procedures. So also, on the other hand, poor documentation that increases the risk of medication errors, misdiagnosis, and inappropriate treatments. So that can compromise patient safety. Also, maintaining clear records provides, legal protection for both patients and nurses, while insurance compliance with, hospital policies, accreditation standards, and legal regulations. So furthermore, proper documentation helps in identifying patterns of patient deterioration, allowing early intervention and sorry, that could be life-saving. So ultimately, effective documentation is essential in delivering high quality, safe, and efficient patient care.
Next is the common documentation errors. So incomplete or missing entries, failing to document assistance, intervention, or patient response can create gaps in care. For example, if a patient receives pain medication, but the response isn't recorded, it can lead to over-medication or under-treatment. Eligible or unclear entries, so poor handwriting and paper charting. Poor handwriting and period. Sorry. Eligible or unclear entries. So poor handwriting and paper charts or ambiguous language can cause misinterpretations, so leading to errors in treatment. Clear document is essential. Late or out of date documents. So delay in documentation for hours can result in missing details or inaccuracy. So recording events as they happen ensures accuracy. So copy and pasting, which is cloning entries. So copying previous documentations without updating the patient's current state can lead to misinformation. Each entry should reflect the most recent assessment. Subjective or judgmental language. Documentation should remain objective and fact-based. Instead of writing, patient is rude or not compliant, say patient refuses medication and raise their voice. Inaccuracy of documenting. It can double check and make sure all documents are complete and correct.
Accurate documentation. Accurate and timely documentation is crucial in healthcare. It emphasizes real-time charting to avoid delays. Objectivity is key. State facts, not assumptions, and use clear professional language. Standardized terminology ensures consistency. Legal and ethical compliance must be maintained, ensuring HIPAA standards are met. Common documentation pitfalls include documenting care not provided, copying and pasting previous records, and charting ahead. These should be avoided.
In this case, Mr. Ron Brown, a 71-year-old man with type 1 diabetes, was admitted for treatment of a right heel ulcer. Diane, his nurse for 2 consecutive days, observed that he experienced pain at the ulcer site, describing it as a constant and throbbing with intensity of a 6 out of 10. After receiving Tylenol number 3 at 8:30 a.m., his pain decreased to a 1 out of 10 by 9:45 a.m. Diane proceeded with his dressing change at 9:50 a.m., noting moderate, fresh, watery, bloody drainage and a small amount of green-yellow pus and redness around the 3 cm by 4 cm ulcer. The wound had healed defined borders, primarily granulation tissue with some yellow slough. Mr. Brown exhibited decreased sensation in the area and did not report discomfort during this procedure. An adaptive dressing with gauze and abdominal pad was applied. His discharge plan remains to return home. There are no major documentation errors, but minor improvements could be made. Pain reassessment occurred 75 minutes after medication instead of within the typical 30 to 60 minutes. Wound drainage was described well, but odor assessment and measurements were missing. Signs of infection, redness, and pus were noted, but no explicitly evaluated for warmth or swelling. Decreased sensation was documented, but lacks clarification on whether it was new or pre-existing. Overall, the documentation is thorough, but could be slightly more detailed for clarity and accuracy. In conclusion, nursing documentation is more than just recording patient care. It's essential for communication, safety, legal protection, and improving healthcare practices. By maintaining accurate records, ensuring high quality care, and to uphold professional and ethical standards. Thank you for your time today. We all would be happy to answer any questions.